Hi, my name is Sabha Ganai, and I'm a cancer surgeon. I'm also a rural disparities researcher. And one of the areas that I'm interested in is access to care, and in particular, patients who have to travel long distances. I have patients who are traveling 5 hours driving, or one patient could only take the train, and it was an 8-hour train ride from Montana. So it's an important issue in terms of an area where there are disparities in terms of how we care for patients in the United States, particularly those who don't live on the coasts. Now, one of my patients actually came from Hawaii, and this was back when I worked in Illinois, and she was diagnosed with an abdominal cancer. And at the time, they didn't really know what it was, and thought it could be ovarian cancer or colon cancer. It ended up being a pretty rare type of cancer called appendix cancer, which is something that's 1 in 1,000 patients in the United States per year. But if you can imagine, we don't really think Hawaii as a rural state, but it truly is. And if you live on Kauai or Maui, you really have to travel, whether flying or by boat, to Honolulu to get some sophisticated treatments, or more complex treatments, you have to go to the mainland. So she was diagnosed with an abdominal cancer, and she spent about a good portion of 3 to 4 years getting chemotherapy treatment that didn't really do much impact on the cancer. She ended up moving to the mainland and, to be with family. And at that time, she established new care with a new medical oncologist. And he looked over all her scans and was just got a new biopsy, and then was just like, I think you need to see a surgeon. So I saw her, and recognizing that this seemed to be appendix cancer, we came up with a treatment strategy that included what we call HIPEC. HIPEC stands for hyperthermic intraperitoneal chemotherapy, and it really is a surgical procedure where we start with debulking, meaning an operation where we try to take out all the tumors that could have spread in the abdomen. And if you can imagine, when an appendix bursts and there's spillage of cancer cells, it's like a Hockney painting, and you can have thousands of little tumors all through the abdomen. And what we do is we strip the wall of the abdomen and take the wallpaper off, so to speak. So after we do the debulking, we do a 90-minute treatment, which is in the operating room while the patient's asleep under anesthesia. And what we do is we hook up the abdomen, and once it's closed, with these catheters where chemotherapy can be pumped and circulated in the abdomen. And the heated part comes from raising the temperature up to around 42 centigrade, which is about 107 degrees Fahrenheit. So a little bit above your normal body temperature. And what that does is it actually improves the ability for the cancer cells to be affected by the chemotherapy treatment. If you can imagine, there are certain kinds of appendix cancers that are kind of slow, indolent cell types that don't really respond to IV chemotherapy very well. And that's the kind she had. They sometimes create this phenomenon they actually call pseudomyxoma peritoni, but another term people have used is called jelly belly. It's a creation of a gelatinous mucin in the abdomen that fills your abdomen up with this non-cellular material that's just mucus. And what the chemotherapy that we do circulate in the abdomen does is it actually tries to kill those culprit cells that are making the mucus so that you have less symptoms in the future. And what we do know in these patients with these low-grade tumors is that these debulking procedures provide a median survival benefit of about 7 to 12 years. And so certainly it really can change people's lives. And so we talked about the surgery and the risks involved, and she went ahead with the operation. Now, I'm not saying that these are not hard recoveries from these kinds of operations, but she did well. And it's now been a decade since that operation. And I learned a little bit about Hawaiian culture from my patient. It's been a pleasure getting to know all of you and taking this class. Aloha.